Microstrip or window FUE is a way to perform FUE without shaving the back of the scalp, which can be very attractive to many people. In general, I would not like to perform this on you. I have performed this in the past, both techniques, in very select patients, but in general, I'm not a big fan of it. Let me first tell you what the heck a microstrip or a window is, and then I can probably talk to you more about why I don't do it. So what a microstrip is shaving little strips in the back of the head so that you can then easily FUE these little stripped areas, but it's such thin microstrips of shaved hair that with longer hair covering it, you actually don't see that anything was done even a few days after the procedure. The window technique for FUE is shaving a square window on the back of the head. This is more commonly done in men with very long hair or women, so that you can easily FUE, harvest the back of the head without having to worry about the rest of the head, because the rest of the head, you think, can just layer their hair over the window and cover it, even during the recovery phase. So there's an immediate attraction to the microstrip and window technique for FUE to limit the need for shaving. But the real problem with that is the long-term consequences. So the microstrip technique, if you start to decide, you know what, I really want to wear my hair a little closer, if you start to wear it closer and closer, there's a risk of actually showing linear scars that are actually worse than a strip scar, because you've got these denuded white lines across the scalp, and you can't wear your hair short. And a lot of reason the number one reason people do FUE is to limit the length, so you can wear your hair super short. Well, you can't do that when you have microstrips. The problem is even worse when it comes to a window, because the window is a hyper-concentrated removal of grafts in a small area. And then if you wear that hair even close enough, you're going to see this big square patch on the back of the head that's missing. Now, how do you fix that? You really have a hard time fixing it. So you create things that are almost unfixable. So in my opinion, these techniques are not great for FUE. They actually lead to greater degree of scarring and greater degree of visibility that's harder to fix than even a strip scar that's gone bad. Now, just as a point of contrast, when I do incisional strip-based scars, I have very, very good outcomes. The vast majority, I get almost 0 millimeters. Sometimes I get 1. In rare cases, I get 3. And I don't see oftentimes anything even beyond that. And those heal so much better than bad FUE. That is almost unfixable. And probably every week, 2 to 3 times, I see horrible over-harvested FUE areas that look terrible that's not even fixable. I mean, I probably can do scalp micropigmentation for some improvement, but I can't fix it. So hopefully this podcast talking about microstrip and window FUE will turn you against trying to have that undertaken.